is this vertebra? This is here, you see, below the skull bone. Below the skull bone, C1, atlas vertebra? Yes, atlas. This is atlas. Remember, atlas vertebra has no body. It has no body. No. Oh, where did the body go? To the lower one. C2? Yes. It got fused with C2? Yes. Maybe. But atlas has no body. Oh. Then what else is there? You know what is this? That is where the skull will be sitting. Skull will be sitting. Which part of skull? This bone. Occipital bone. Are you talking about atlanto-occipital joint? Yes, atlanto-occipital joint. So atlanto-occipital joint, fine. I remember atlanto-occipital joint is for yes movement. Yes. And I remember it was some ellipsoid synovial joint. Yes, ellipsoid synovial joint. Some books will say condylar. But before you say condylar, you should say ellipsoid. Can you see the foramen transversarium here? Where? Can you see the foramen transversarium here? For what? For the passage of the vertebral artery. There's a question asking, vertebral artery, what is the relation to the atlas vertebra? It is in foramen transversarium. No. What is the other relation after it has passed the foramen transversarium? Oh, that I'll tell you. It is having a groove on the atlas vertebra. It is having a groove on atlas vertebra means it will be passing through that groove. Yes. Why? Why it is passing there? Because then it will have to enter the cranial cavity and join to form basilar artery in the cranial cavity. Oh, so vertebral artery would have come from foramen transversarium and arching over the superior surface of the atlas vertebra, posterior arch. Yes, posterior arch. So vertebral artery would have passed the upper 6 foramen transversarium, including C1 vertebra, and then arching over the posterior arch of the atlas vertebra superiorly to enter the foramen magnum and enter the cranial cavity. Upwards. Yes, upwards. Okay. I think there is an anterior tubercle here. There is a posterior tubercle there. Yeah, that is posterior. So posterior tubercle. This is anterior. So anterior tubercle. Can you tell me what is the superior articular fascia like? We are in the cervical vertebra. I remember. I think superior articular fascia for cervical vertebra are directed. Yes. Backward and upward? Yeah, correct. Backward and upward. Correct. Backward and upward. That's correct. No lateral, no medial. No lateral, no medial, only backward, upward. Cervical region. Then what is this? This is the number 2. C2 axis vertebra? Yes, C2 axis vertebra. You were telling this vertebra got the body of the upper vertebra. I'm just telling, but maybe I am correct. What is happening? You see, it is having a process which is called odontoid process or dens of the axis. Dens of the axis, what is the other name? Odontoid process. And what about the odontoid process? It is the other name of the dens, odontoid process. And I'm assuming that it was the body of the C1 vertebra. A body of the C1 vertebra, atlas vertebra is fusing with the body of the C2 vertebra. Yes. And producing some elevation which is called as the dens of axis or odontoid process of axis. I don't see any elevation here. You don't see any elevation? No. You have to see from other view, then you will see some elevation. But this axis vertebra has its own body and one more body is attaching to its body. So 2 bodies are there. No, it's not like that 2 bodies are there, but there is a projection. What is that projection? I can't see nothing here. You will see in some other view, but this is the foramen transversarium where the vertebral artery will be passing. That you remember. Now what is the next thing? Next thing is you are doing the yes movement. And when you do the yes movement, you are moving atlanto-occipital joint. And atlanto-occipital joint is ellipsoid synovial joint. And if ellipsoid is not in the option, then you can say condylar, because there are condyles, occipital condyles, condylar synovial joint. And where do I do no movement? No movement. No movement. It is the atlantoaxial joint, C1, C2. Yes, C1, C2, atlantoaxial joint. And what kind of joint is C1, C2 atlantoaxial joint? You see now, can you see this thing? This is the dense or odontoid process. This is the body of C2. Oh, that is the body of C2 and this is the dense odontoid process. I think this is what you are telling, that odontoid process appears to the body of C1 vertebra, attaching fuse with the C2 vertebra body. Yeah, maybe. It is like this. So this is the body of C2, yes. And you are assuming that this projection, which you are called odontoid process, is the body of C1. Yeah, that is just an assumption. Maybe it got broken from there and got fused here. This projection is called odontoid process, dense of axis. Yes. Where is it going? It is going to the anterior arch of the atlas. And when it goes to anterior arch of atlas 1, transverse ligament is there. It will hold the odontoid process. So C2 is giving some odontoid process and it is held by some transverse ligament of the C1 vertebra, atlas vertebra anteriorly. Yes. What is happening now? You see what is happening? No movement. So this no movement is happening at C1, C2 vertebra. Yes. Who is rotating? You tell me who is rotating. The skull. Skull is rotating on what? Actually, skull and atlas vertebra both are together a unit, rotating on axis vertebra. So occipital and atlas bone became together one unit. Yes. And then they are rotating on the axis vertebra. Yes, that is the point here. See, it's a rotatory joint. You are telling that there is some central axis on which there is some rotation going on. Yes, rotatory joint. It is called as pivot synovial joint, or it is called trochoid synovial joint. What is trochoid? Trochoid is pivot rotatory, rotation. Who is rotating? Actually, skull and atlas became one unit, and they were then rotating on the axis vertebra. So they became one unit and they are rotating on the axis vertebra like this, like this. Yes, that is the point. So you are talking about atlantoaxial joint basically. Yeah, at least atlantoaxial, but as the atlas is moving, the skull is also moving. So rotating, yes, that is the point. And this is the transverse ligament which was holding odontoid process of the axis on the anterior arch of the atlas vertebra. Yes. Atlantoaxial joint for rotation. Yes, rotatory movement. Pivot joint, trochoid joint, no movement joint.